Thank you for joining us today to discuss risk reduction for sudden infant death syndrome and other sleep-related causes of infant death. This training is provided through the Safe Sleep North Carolina campaign funded through the North Carolina Department of Public Health and implemented by the UNC Center for Maternal and Infant Health. My name is Megan Kennedy and I help to coordinate the Safe Sleep North Carolina campaign. Before we begin, let's discuss training disclosures. To be awarded 1.5 contact hours, participants must complete the entire learning session and complete and submit the evaluation. Contact hours are available for this training until 7/23/2020. Neither the presenter nor members of the planning committee for this training have any conflict of interest related to the content of this training. The continuing nursing education activity was approved by the North Carolina Nurses Association. At the end of this training, you will be asked to complete a brief survey. When you complete the survey, you will be emailed your certificate of completion. Upon completion of this training activity, providers will be able to define sudden unexpected infant death, SUID, and sudden infant death syndrome, SIDS, and other sleep-related causes of infant death, describe national and state trends regarding sleep-related deaths, describe the latest safe sleep recommendations, describe ways to communicate risk reduction messages about sleep-related causes of infant death to parents and caregivers, and to identify local, state, and national resources available for additional patient and provider support. Providers practicing in a range of specialties play a vital role in educating parents and caregivers to help reduce the risk of sleep-related deaths. Prenatal care providers are the first line of education about infant care for many pregnant women. The hospital stay after delivery is another prime opportunity for encouraging safe sleep. Pediatric and family medicine providers should also include guidance on safe sleep as they are seeing their newborn and infant patients. Lactation consultants, postpartum care providers, and WIC professionals can work with families after the baby is born to encourage and support safe sleep practices. Home visiting providers can work one-on-one with families in the home to promote safe sleep. Child care workers can model safe sleep practices themselves and promote safe sleep practices with the families they serve. The hope is that this training gives you needed information and realistic suggestions for incorporating safe sleep into your daily practice or reinvigorating your current efforts. The loss of a baby is devastating for families and communities. Everyone has a role to play in helping parents and caregivers keep babies safe and healthy, and your contributions are essential. You are your patient's most credible, reliable source of health information and best source about safe sleep. Thank you for all you do, and let's get started. First, let's go over some key definitions. Sudden unexpected infant death, or SUID, is the death of an infant younger than 1 year of age that occurs suddenly and unexpectedly. After a full investigation, SUIDs that occur during an unobserved sleep period may be diagnosed as one of three types of SUIDs: sudden infant death, or SIDS, accidental suffocation and strangulation in bed, or undetermined unknown. These investigations are often very complicated, and this makes it difficult to make a diagnosis. In many cases, the evidence is not clear or not enough information is available, so the death is considered to be of undetermined cause. Sudden infant death syndrome, or SIDS, is the sudden death of an infant younger than 1 year of age that cannot be explained even after a full investigation that includes a complete autopsy, examination of the death scene, and review of the clinical history. It's important to note that in North Carolina, if a sleep-related infant death was associated with an unsafe sleep environment, including bed sharing, it would not be classified as SIDS. Bed sharing is when an infant sleeps on the same surface, could be a bed, couch, chair, as another person. That person could be a parent, sibling, or caregiver. Now let's talk about what SIDS is and what SIDS is not. SIDS is nationally the leading cause of death in infants between 1 month to 1 year of age. It is a sudden and silent medical disorder that can happen to a seemingly healthy infant. Currently unpredictable and unpreventable, but the risk can be reduced. A diagnosis of exclusion in which the cause of death can be determined only after ruling out other causes. SIDS is a recognized medical disorder listed in the International Classification of Diseases, and SIDS is an infant death that leaves unanswered questions. SIDS is not the cause of every sudden infant death. It's not the same as suffocation. It's not caused by vaccines or immunizations and shots. It's not contagious. It's not the result of neglect or child abuse. It's not caused by cribs or vomiting or choking. And it's not preventable, but there are ways to reduce the risk. Researchers use the triple risk theory that you see here to explain what likely causes SIDS. In this theory, all three factors shown here have to be present for SIDS to occur. So this means that the baby's vulnerability is undetected, the infant is in a critical developmental period that can temporarily destabilize his or her systems. The infant is exposed to one or more outside stressors that he or she cannot overcome because of the first two factors. Having only one of these features may not be enough to cause death from SIDS, but when all three combine, the likelihood of SIDS is higher. The first factor is a vulnerable infant. This is an underlying defect or brain abnormality that makes the baby vulnerable. Certain factors, such as defects in the parts of the brain that control respiration or heart rate, or genetic mutations, result in vulnerability. Critical developmental period. During the first 6 months after birth, infants go through many quick phases of growth that can change the body's ability to adjust or regulate itself, its temperature, breathing rate, heart rate, and sleeping and waking patterns. Some of these changes may make the infant's body system unstable. Outside stressors. Most babies encounter and can survive environmental stressors such as secondhand tobacco smoke, overheating, a stomach sleep position, or an upper respiratory infection. However, an already vulnerable infant may not be able to overcome them. Although these stressors are not believed to single-handedly cause infant death, they may tip the balance against a vulnerable infant's chances of survival. Risk factors that put infants at higher risk for SIDS include side and stomach sleep position, prenatal and postnatal tobacco smoke, alcohol, and illicit drug exposure, soft or cushioned sleep surfaces, including sofas, couches, armchairs, and bed sharing, soft bedding, including pillows, blankets, sheepskins, bumper pads, and positioners, head covering, and overheating, and preterm or low birth weight infants. Many of the risk factors for SIDS are strikingly similar to those of other sleep-related infant deaths. Accidental suffocation and strangulation in bed is one type of SUID. It's a cause of death code used for vital statistics purposes. This code is used to identify infant death caused by suffocation or asphyxia, the blockage of the infant's airway, in a sleeping environment. For example, suffocation by soft bedding. This is when soft bedding, like a pillow or an air mattress, blocks the infant's airway. Overlay. When another person shares the sleep surface with the infant and lays on or rolls on top of or against the infant while sleeping, blocking the infant's airway. Wedging or entrapment. When an infant gets trapped between two objects, such as a mattress and a wall, bed frame, or furniture, blocking the infant's airway. Strangulation. When something presses on or wraps around the infant's head and neck, blocking the airway. Let's explore the scope of the problem of sleep-related deaths in the U.S. This graph shows the trends in sudden unexpected infant death rates in the United States from 1990 through 2016. In 1990, the SUID rate was 154.6 deaths per 100,000 live births. The SUID rate declined considerably following the release of the Back to Sleep campaign, which is now the Safe to Sleep campaign. Since 1999, declines have slowed. In 2016, the SUID rate was 91.4 deaths per 100,000 live births. SIDS rates declined considerably from 130.3 deaths per 100,000 live births in 1990 to 38 deaths per 100,000 live births in 2016. Unknown cause infant mortality rates remained unchanged from 1990 until 1998, when rates began to increase. In 2016, the unknown cause mortality rate in infants was 31.6 deaths per 100,000 live births. Accidental suffocation and strangulation in bed mortality rates remained unchanged until the late 1990s. Rates started to increase beginning in 97 and reached the highest rate at 23.1 deaths per 100,000 live births in 2015. In 2016, the rate was 21.8 deaths per 100,000 live births. Currently, as a nation, we experience about 3,500 infant sleep-related deaths each year. This chart shows the breakdown of sudden unexpected infant death by cause for the year 2016. 42% of cases were categorized as sudden infant death syndrome, followed by unknown causes at 34%, and accidental suffocation strangulation in bed at 24%. Now let's take a closer look at sleep. In 2016, North Carolina had around 12 infants die every month of sleep-related causes, almost 3 a week. Here's a list of the leading causes of infant death in 2016 for North Carolina. When you total other unknown causes, which are all sleep-related deaths in this case, accidental suffocation, strangulation in bed, and SIDS, you see that SUIDs, or sleep-related deaths, is the third leading cause of infant death in North Carolina and the leading cause of death during months 1 through 12, the post-neonatal period. Here's a breakdown of SUID, or sleep-related deaths, for 10 years, 2007 to 2016 in North Carolina. It is important to note that in 2012, the North Carolina Chief Medical Examiner began to classify these deaths differently. This is because it was now understood that many deaths in the past were likely classified as SIDS were not clear-cut cases of SIDS, but there were other factors possibly at play. You can see the shift in the number of deaths classified as SIDS to unknown at this time. The total deaths for 2016 are actually a little higher than the last chart reflects, the total being 144, not 139. This is after the final investigation for 2016, so just wanted to note that discrepancy. This chart here for 2016 shows the breakdown of the 144 sleep-related deaths by cause. By and large, these deaths are undetermined or unknown at 105. Next is accidental asphyxiation at 28, and the smallest number of cases classified as SIDS at 11. Based on the 2016 data in North Carolina, 9 out of 10 infant sleep-related deaths occurred in an unsafe sleep environment. So let's take a closer look at that. The large majority, 133 out of the 144 deaths, were associated with unsafe sleep environments. This could be soft bedding, in the crib, bumper pads, stuffed animals, in this infant sleep environment, or if the infant is sleeping on a couch or an adult bed. And 91 of these, the majority of these deaths, occurred in the unsafe sleep environment of bed sharing. Here's another way to see the impact of unsafe sleep environments. Of the 144 sleep-related deaths for 2016 in North Carolina, 92% of them are associated with unsafe sleep environments, and of those, 68% are specifically bed sharing associated, and the rest were associated with some other safe sleep environment other than bed sharing. Here's a snapshot of the sleep-related deaths caused by unsafe sleep environments across the state for 2016. Here's a list of all sleep-related deaths by county for 2016. This list includes SIDS. The last view of the map did not. Here's a breakdown of the location of the 28 accidental suffocation and strangulation deaths. So here is based on the examination investigation of where they occurred. You can see that the majority of these are occurring in an adult bed with an adult and possibly siblings. Here is a breakdown of the location of some of the 105 undetermined unknown deaths. There are some locations that were unknown, so those obviously are not included. Again, you can see the majority of these, the adult bed with adult, is coming in at the highest. Here's a breakdown of deaths by age of the infant for 2016. As you can see, those early months really are the most common time of death and therefore the riskiest. Now we will explore how to best prevent these deaths from occurring by reviewing the latest policy statement from the American Academy of Pediatrics, the AAP, regarding recommendations for a safe sleep environment. There are 18 recommendations. We will go through all of them briefly. It's highly recommended that you read the latest policy in its entirety yourself. It's an easy read and has a lot of good information in there. So the first recommendation is back to sleep for every sleep. So this is for infants should be placed on their back, not on their side, not on their stomach, for every sleep by every caregiver until the child reaches 1 year of age. Side sleeping is not safe and is not advised. Preterm infants should be placed on their backs to sleep just as full-term infants should. Skin-to-skin care is recommended for all mothers and newborns. The second recommendation is to use a firm sleep surface. Infants should be placed on a firm sleep surface covered by a fitted sheet with no other objects or bedding in place. Infants should not be placed on sofas, air mattresses, adult bed, or other soft surfaces. So if you've ever seen one of these pack and play mattresses, you know that they are thin and firm. A word about crib safety. Cribs should have firm mattresses that is the correct size for the crib, have slats that are no more than 2.5 inches apart, so smaller than the size of a can of soda. Should be assembled according to the manufacturer's instructions. Cribs should not have missing, broken, or loose parts, have chipped, cracked, or peeling paint, have a drop side, have corner posts that protrude above the side of the crib, and cribs should not have cutout designs on the head or footboard. For more information, you can visit this link. This link will also be sent out at the end of the survey when you complete your evaluation. The third recommendation is to breastfeed. Breastfeeding is associated with the reduced risk of SIDS. So this means that since we are working to reduce sleep-related infant deaths, we should consider strategies that promote breastfeeding. This can get complicated because we know that there's research that supports that bed sharing can lead to longer breastfeeding duration. But we also know that bed sharing leads to more infant deaths. But what does this mean when a patient wants to bed share to promote breastfeeding? Lori Feldman Winter is a pediatrician and safe sleep and breastfeeding expert who is currently working on the National Action Partnership to Promote Safe Sleep Improvement and Innovation Network, which aims to make safe sleep and breastfeeding the national norm. She has decades of experience grappling with these kinds of questions. Dr. Feldman Winter suggests that despite the benefits to breastfeeding, the fact remains that there is a 5 times greater risk for infant death when bed sharing when the infant is less than 3 months of age. This clear risk means we need to find ways to promote breastfeeding while ensuring it happens in a safe sleep environment. We will discuss more about how to have these meaningful conversations that can help mothers and caregivers to better understand the risks of bed sharing while reinforcing the advantages of breastfeeding. The fourth recommendation is to share the room, not the bed. It's recommended that infants sleep in the parent's room, but on a separate surface designed for infants for the first year of life, but at least for the first 6 months. This practice, as you can imagine, could help enforce the idea of breastfeeding, but sleeping on a separate surface. The fifth recommendation is to keep soft objects and loose bedding away from the infant sleep area. This includes things like bumper pads, pillows, blankets, and stuffed animals. This is the idea that bare is best when it comes to where baby sleeps. The sixth recommendation is to consider offering a pacifier at nap and bedtime. Studies have reported a protective effect of pacifiers on the incidence of SIDS. Recommended guidelines for pacifier use. If a mother is breastfeeding, parents should wait until breastfeeding is well established before introducing a pacifier. Offer the pacifier, but do not force the infant to take it if he or she refuses it. Use a clean and dry pacifier. Do not coat it with anything sweet or sticky. And if the pacifier falls out of the infant's mouth during sleep, there is no need to reinsert it. It is the beginning of the sleep period with the pacifier in the mouth that seems to be the most important in terms of reducing SIDS risk. The seventh recommendation is to avoid smoke exposure during pregnancy and after birth. Infants whose mothers smoke during or after pregnancy are at an overall greater risk of SIDS. Exposure to secondhand smoke in the household doubles a baby's SIDS risk. And I wanted to bring to your attention a local perinatal tobacco cessation resource, which is the You Quit to Quit program. It provides training and technical assistance to providers across North Carolina to provide evidence-based tobacco screening and cessation counseling. This is an initiative of the UNC Center for Maternal and Infant Health. This program has also created a suite of patient education materials regarding tobacco during the perinatal period available for free through the Women's Health Branch. I encourage you to check out the website youquit2quit.org for more information regarding resources and a free on-site training for your staff. The eighth recommendation is to avoid alcohol and illicit drug use during pregnancy and after birth. There is an increased risk of sleep-related deaths with prenatal and postnatal exposure to alcohol or illicit drug use. The ninth recommendation is to avoid overheating and head covering in infants. Studies have shown an increased risk of SIDS with overheating. The definition of overheating in these studies does vary. The trick is usually to just say the baby should wear one more layer than the parent does to bed. So no hats, no extra bulky jackets to bed, that's for sure. The 10th recommendation is that pregnant women should obtain regular prenatal care. There is substantial evidence linking a lower risk of SIDS for infants whose mother obtained regular prenatal care. Pregnant women should follow guidelines for frequency of prenatal visits. The 11th recommendation is that infants should be immunized. There is no evidence that there is a causal relationship between immunizations and SIDS. Recent evidence suggests that vaccination may have a protective effect against SIDS. The 12th recommendation is to avoid the use of commercial devices that are inconsistent with safe sleep recommendations. These include things like positioners or sleep wedges or any type of pillow, even if it's suggested to be good to reduce flat heads. 13th recommendation is to not use home cardiorespiratory monitors as a strategy to reduce the risk of SIDS. Recommendation is supervised awake tummy time. It's recommended to facilitate development and minimize development of positional plagiocephaly or a flat head. The 5th recommendation is that there is no evidence to recommend swaddling as a strategy to reduce the risk of SIDS. Here are some safety considerations regarding swaddling. There seems to be a lot of questions around this issue. So first, the recommendation is to use a thin blanket to stop swaddling at around 2 months or once the infant shows signs of wanting to roll over. Make sure that the wrap is not too tight where you're restricting the breathing or putting undue pressure on the baby's hips. You should be able to slip 2 to 3 fingers under the swaddled blanket easily. Make sure the wrap is not too loose, allowing the infant to wiggle free of the swaddle and become covered by the blanket. Make sure that the wrap is not too high, should be no higher than the shoulders to make sure that it's not covering the infant's face. And when swaddling, be sure the infant is on their back in a safe sleep space. The 6th recommendation is that healthcare professionals should endorse and model the SIDS risk reduction recommendations from birth. The 17th recommendation, media and manufacturers should follow safe sleep guidelines in their messaging and advertising. And 18th, the recommendation is to continue the Safe Sleep campaign to focus on ways to reduce the risk of all sleep-related infant deaths, including SIDS, suffocation, and other unintentional deaths. Pediatricians and other primary care providers should actively participate in this campaign. Now let's talk about strategies for engaging with parents and caregivers regarding safe sleep. First, I want to acknowledge that promoting and practicing safe sleep is incredibly important, but not easy for providers or families. There are a number of factors that influence parents and caregivers about infant sleep. These include family and cultural norms. For many families, this means putting your baby on their stomach to sleep, or sleeping with your baby, or dressing them warmly, or putting them on soft bedding, and that's just part of their family, part of their cultural norms. The physiology of the infants. Some infants sleep better in certain positions that are not safe. Past experience. Some parents with other children may be basing their current practice on what they did with their other babies. Social determinants of health and environmental issues. For some families, they may only have an air mattress to sleep on, or they may not have room for a pack and play in their small housing area. Parents' need for sleep. Many parents, probably most, are desperately trying to do whatever they can for their infant to sleep so that they too can sleep. Desire to bond or breastfeed. Many parents want to be near their baby to bond with them or to be near them to breastfeed, and this could result in bed sharing. Another factor is a desire to protect. This might be to protect their infant from violence in the home or just outside the home, or fear of exposure to things like cockroaches or rats or other things in the house. Information from other parents. Parents are looking for help, and if they don't hear it from providers, they will definitely be hearing something from well-intentioned but ill-advised family and friends, or don't forget the world of blogs and social media. The research supports that what you say and do as a provider does make a difference. It is important that you know about safe sleep information, that you show and model safe sleep practices yourself, and that you tell the parents and families that you work with about safe sleep. Try to remember when talking to families about safe sleep that they do want what is best for their infants. Keep this at the forefront of your discussions, and you can become or remain a valued and trusted needed resource for these families. Consider using a strength-based approach when talking about safe sleep. Families feel valued, not judged with this approach. You can ask for permission to share information. You can be respectful and sensitive. The goal is to reduce the risk by sharing information, answering questions and concerns, discussing resources, problem solving, and offering support. For conversations about safe sleep to be successful, they need to be judgment-free. There are several techniques that can encourage open dialogue. One technique is using motivational interviewing. This focuses on open-ended questions such as, what do you like about bed sharing? What makes it hard for you to put your baby on their back to sleep? By proactively avoiding yes or no answers, health professionals can better understand mothers' and families' motivation and provide solutions that work for their family. Here are a few open-ended questions to talk about safe sleep that you could consider using. What have you heard about ways to keep your baby safe while they sleep? What worries or questions do you have about how and where your baby should sleep? What do others who will care for your baby know about safe sleep practices? What plans have you made for where your baby will sleep, or where does your baby sleep? We recommend that you put your baby to sleep alone on his or her back in a crib. What do you think about these recommendations? It's important to understand that although the ABC message of safe sleep, a lone back crib, is the gold standard, parents often have questions or concerns about this. So it's important to have a discussion about safe sleep. Here are some of the common challenges when it comes to safe sleep recommendations. Those include bed sharing, concerns about back sleeping, and sleep environment. When it comes to bed sharing, it is on the rise despite known risks. There is no 100% safe way to bed share. It can be intentional or unintentional. The AAP continues to advise against bed sharing. However, in their latest recommendation, there is now acknowledgement that parents do bed share both intentionally and unintentionally, and that should be addressed to reduce risks. So the following guidelines are for all parents, whether they plan to bed share or not. Feeding a baby at night or caring for a baby in an adult bed is safer than on a couch or recliner, both of which are extremely dangerous. If feeding or caring for an infant in a bed, keep all blankets, sheets, comforters, and pillows away from the baby to prevent overheating and or accidental suffocation. It's also really important to know that there's circumstances in which bed sharing is very dangerous. These include when the infant is younger than 4 months, if the infant was born premature or had low birth weight, if the bed sharer uses tobacco, or if the mother used tobacco during pregnancy, if the bed sharer has taken illicit drugs or medicine that causes drowsiness, if the bed sharer has consumed any alcohol, if the bed sharer is not the parent of the infant, if there are multiple bed sharers, so this includes other children in the bed, even pets, if the sleep surface is soft, such as an old mattress, a water bed, a pillow top, or air mattress, if the sleep surface is a couch, sofa, or recliner, if there is soft bedding, such as pillows or blankets present in the bed, these are all circumstances in which bed sharing is more dangerous. Despite counsel regarding the risk, some parents will bed share. Although there is no 100% safe way to bed share, there are ways to reduce risks. Be sure to discuss all the circumstances that we just shared that make bed sharing very dangerous with families. And remember to encourage sharing with families that they should not place their baby on their back for every sleep, to never sleep with the baby on an armchair, couch, sofa, or air mattress, to remove soft items and bulky items from the sleep area, to use only light sleep clothing on the baby, to not cover the baby with adult bedding, and to move the bed away from the wall so that the baby cannot become trapped between bed and the wall. Some parents find themselves accidentally falling asleep with their babies. Be sure to share with families the circumstances that make bed sharing very dangerous so they are aware of the risks, while continuing to encourage parents to do their best to adhere to having their infants sleep in a separate sleep surface. Share the following tips to enhance safety. Ask another adult to put the baby back in their crib if they see that you have fallen asleep with the baby. If caring for your baby at night, set yourself an alarm in the event that you fall asleep. Remove pillows and bulky bedding in case you do fall asleep while caring for your baby. Do not move to a couch or armchair to care for your infant at night. To make it easier to care for your infant at night, have their crib or pack and play near your bed, but do not have them in your bed. Next, let's discuss how to address some common questions when it comes to bed sharing and some possible answers that promote safe sleep using a strength-based approach. So the first question is, how am I going to breastfeed if my baby doesn't sleep with me? Here's a possible answer. That is great that you are breastfeeding. Can you tell me what you like about bed sharing for breastfeeding? So at this point, you can listen to their answer and summarize what they say back. I see, by bed sharing, you are able to easily breastfeed. That makes sense, and you are right. Having the baby nearby does often help to promote breastfeeding. Unfortunately, bed sharing is related to high rates of infant death, especially with infants less than 4 months like yours. Can I share with you some other ideas about how to breastfeed and be sure that your baby is sleeping safe? So at this point, you can wait for their permission. Great. One idea is to put your baby's crib near your bed so that you can easily pick them up for feeding during the night and then return them to the crib for sleeping. What do you think about this idea? So as you can see from this point, it's really more of a conversation, not just telling them what to do and what not to do. So from this point, you can keep working with the families about how to continue to breastfeed, but also to promote safe sleep. All right, another question is, I want to bed share with my baby because it makes me feel close to them. Is that wrong? So a possible answer, I know you want to feel close to your baby because you love them, but it is much safer for your baby to sleep on their own sleep space. Can you tell me other ways you can feel close to your baby that doesn't include sleeping with them in the same bed? So let them share and acknowledge their desire to be close to their baby. This is really important. And then you can keep talking with them. Perhaps saying something like, sleeping with an adult or in an adult bed increases the risk of a baby dying because they can be accidentally suffocated from bedding or from the parent. You can have your baby near you, but keep them safe by having them sleep on a separate surface near your bed. Can I share with you some of the times that bed sharing can be the most risky? So at this point, you can share the circumstances that we've listed before and go on to talk with them, possibly sharing. There is no 100% safe way to bed share, but if you do decide to bed share, try to make the sleep space safer by making sure there are no pillows near the baby, no blankets, and that the bed is pulled away from the wall, and then the mattress is firm and not soft or an air mattress. This is actually good for all parents to do whether they plan to bed share or not. What are your feelings about this information? So again, it's a conversation. You want to make sure that you are reducing the risk and working with the parent. Okay, last question for bed sharing. I sometimes fall asleep while caring for my baby. What should I do? Very realistic situation. Here is a possible answer. I understand that happens to many parents. Caring for a newborn is exhausting, and I know you are doing your best. I am glad you asked me about this. Can I share with you some ideas? At this point, you can get their permission and move on. You can, one, is ask others to help you, such as your partner or parent or any other adult living in the house, to move the baby back to her crib if they see that you've fallen asleep with them. Let them know that you do not want to fall asleep with your baby at night. Another idea is to set an alarm on your cell phone. You could put it on vibrate. And if you know that you're going to be up to nurse the baby for about 30 minutes, set that alarm for 30 minutes. So therefore, if you fall asleep, you'll be awoken and you won't be asleep for very long. And then you can move the baby back to their bed. So we all do get sleepy. Another important tip is not to move to a couch or recliner. This is actually a really risky place to fall asleep with the baby. Another tip is just to keep your bed area clear of all bulky bedding in case you do accidentally fall asleep. What do you think about these suggestions? So again, you can keep going back and forth, having a dialogue about how to reduce risks and working with families. Now we can explore common concerns that parents have about putting their baby to sleep on their backs. A really common question is, won't my baby choke if he or she throws up while sleeping on his or her back? At this point, you can give answer possibly something like, great question. A lot of parents wonder about this. Actually, no, healthy babies naturally swallow or cough up fluids. It's a reflex. All people have to make sure the airway is always open. Infants are actually less likely to choke when placed on their backs. When your baby is on their stomach, anything spit up can block the windpipe and cause choking or breathing problems. Even if your baby has reflux, it is still safest for them to sleep on their back. What do you think about this? Or what other questions do you have about infant sleep? Another question is, what if my baby's grandparents or caregivers wants to place my baby to sleep on his or her stomach at nap time? Here's a possible answer. I am so glad you asked. Babies who usually sleep on their backs but who are then placed to sleep on their stomach are at very higher risk, or at, excuse me, a higher risk of SIDS. So it is important for everyone who cares for your baby to use the back sleep position for all sleep times, for naps and at night. How do you feel about talking to your parent or caregiver about this? What else can you tell me about how your infant is sleeping? So again, just really important to have that back and forth conversation about how to make a sleep space safer. Another question, my baby sleeps better on his stomach. Why should I put them on their back? Possible answer, a lot of babies do sleep better on their stomachs, but that is actually part of the problem. When babies sleep on their stomach, they are less reactive to noise. They can experience sudden decreases in blood pressure and heart rate control, and they can experience less movement and have longer periods of deep sleep. These things can put a baby at higher risk of SIDS. I know you want your baby to sleep well, but stomach sleeping is not safe. Putting your baby to sleep on their back really helps to lower the risk of SIDS. What do you think about this suggestion? So again, open communication, talking about how to reduce risk, seeing what works with the parent. Lastly, let's look at some common questions when it comes to safe sleep environment. Here's a possible question. What does it mean to sleep in a safe sleep environment? I am really glad you asked that. I know there are lots of things to know when it comes to taking care of a new baby. Can you tell me what you know about safe sleep and any questions you have? So at this point, let them share with you what they know. And here's a possible answer back. Thank you so much for sharing. A good way to think of safe sleep is to remember ABC. A is for alone. This means that the baby sleeps alone, not with another person or a sibling or a pet. What do you think about this? Again, get their feedback. B is for back. This means the baby sleeps on their back for every sleep. Again, check in, see what questions they have about this recommendation. And C is for crib. This means they sleep in a crib or bassinet or pack and play without anything else in the crib but a tight fitted sheet on a firm mattress. No blankets, stuffed animals, pillows. This also means the baby doesn't sleep on a couch or an adult bed because they are unsafe. What do you think about this recommendation? And then you can continue to talk with them about other questions they may have about their baby's safe sleep environment. Another question is, I put my baby in their own crib, but I do use bumper pads to make it safer. Why isn't that okay? Well, that's great that you're putting your baby in their own crib. Can you tell me what you like about bumper pads? It sounds like you want to make a safe and comfortable place for your baby to sleep. But what we know is that having extra stuff around the baby when they sleep is not safe. This includes bumper pads and other items. They can easily get covered by a blanket or stuffed animal and not able to breathe. Bumper pads seem like a good idea and you see them everywhere, but babies are much safer without them because they can get caught up in them and this can cause them to suffocate or be strangulated. What do you think about this information? Or what other questions do you have about your baby's crib or sleeping? Why can't my baby sleep in their car seat at night? Possible answer? I am glad you asked that. What other places do you have available that your baby can sleep at night? This is good to ask because you might want to find out if the car seat is being used because there isn't anywhere else for the baby to sleep. You can proceed by saying something like, I understand that sometimes we just want our baby to sleep wherever it works, but unfortunately car seats and other sitting devices like swings or um, um, strollers aren't safe. It's best for infants to sleep alone on a firm, flat crib or pack and play mattress. These sitting devices are not recommended for routine, long periods of sleep. It's also important to know that car seats and sitting devices are not stable on a crib mattress or other elevated surface. So if they're sleeping in one, you don't want to put them on top of something else. Infants sleep infants sleep safest on a flat surface and infants should not be left unattended in a car seat and similar products or with the straps unbuckled or partially unbuckled because the baby can actually become entangled in those straps. Can I share with you some ideas to keep your baby safe when they sleep? Or you can ask them what they think about what you just recommended. Encouraging safe infant sleep practices. It's clear that patients are more likely to remember and follow instructions when a healthcare provider uses a positive tone, provides adequate and easy to understand information, and allows the patient to ask most of the questions. Remember, meaningful conversations engage with the circumstances and experiences unique to each individual family. When we have judgment-free, realistic, open-ended conversations, they encourage families to openly discuss what they see as safe behavior and thus more easily understand the risks. And the more meaningful conversations that occur, the more babies who will sleep safely. To finish our time together, I want to inform you about some resources that you may find helpful. This is a front and back handout that's available in English and Spanish that shares key safe sleep information and many common questions. This handout was developed with the Safe Sleep Advisory Committee and many providers from across the state to best understand issues that their patients were having and how to best address those. It is suggested that you use this flyer with families to share safe sleep information and, not just to hand it to them, but just to really talk through the information that's provided. Other resources include posters. There are, again, in English and Spanish, there's a general message on the far left, and then the other two are really focused on older caregivers or grandparents talking about safe sleep. And these are all available for free to order for North Carolina providers by going to this link, and this will be emailed out to you again when you finish the evaluation. And you click on the publications form, and a order form comes up. If you look at page 3 under parenting and baby, that's where you will find the safe sleep information. There are national resources also available through the Safe to Sleep campaign. If you go to their website, which again I will share in the email, if you go to campaign materials, you will find a host of information for providers and also for patients. They also have information that is for grandparents. So lots of good information, lots of good resources, and again, these are free. Another important website that I mentioned when talking about cribs is the Consumer Product Safety Commission website. They have information that ranges from videos to posters, and they also have crib standards and recall information. And I will be emailing out that link as well. Thank you so much for taking the time to learn more about sleep-related deaths and how to reduce the risk of these tragic deaths from occurring. Safe Sleep North Carolina is here to be a resource. Please let us know how we can help serve you, and please stay in touch. You can always find us at safesleepnc.org. And please see the next slide to complete the evaluation. So at this time, you can click here for the evaluation. Upon completion of this evaluation, you will be emailed a certificate of completion along with other resources and websites that were mentioned during this training. Thank you so much, and we appreciate your time and effort.